What is cardiovascular occlusion? Cardiovascular occlusions are blockages that occur in the coronary arteries, which are the blood vessels that provide blood flow to the heart. This blockage is usually the result of a fatty substance called plaque building up and narrowing the arteries. Decreasing or stopping blood flow to the heart has some repercussions on the person. These reflections are symptoms of cardiovascular occlusion. Cardiovascular occlusion may cause symptoms such as chest pain or tightness, shortness of breath, heart rhythm instability, abdominal pain, nausea and dizziness as a result of reduced blood flow. A heart attack can occur at points where blood flow is completely cut off. To name some factors that cause decreased blood flow to the heart, these factors include diabetes, obesity, smoking, unhealthy diet, inactivity and stress. What causes cardiovascular occlusion? Cardiovascular occlusion occurs when a fatty substance called plaque builds up in the heart vessels known as coronary arteries. These plaques block the arteries, reducing healthy blood flow to the heart. Factors that may lead to this process are smoking, diabetes, obesity, genetics, unhealthy diet, inactivity and a history of heart attack. Factors that cause cardiovascular occlusion can be listed as follows: cigarette, diabetes, obesity, genetic factor, unhealthy eating, inactivity, history of heart attack, high blood pressure and high cholesterol, old age, stress. What are the symptoms of cardiovascular occlusion? Symptoms of cardiovascular occlusion include chest tightness and pain, shortness of breath, palpitations and abnormal heart rhythm, left arm pain, dizziness, and numbness in the legs and arms. Symptoms seen in cardiovascular occlusion are pain and feeling of tightness in the chest, heart palpitations and irregular heart rhythm, pain in the arms, shoulder, back, neck and jaw area, dizziness and fainting, fatigue and exhaustion, shortness of breath, nausea and vomiting, cold sweats. One of the first signals of cardiovascular occlusion is chest pain or tightness in the chest. This condition, which feels like a heart attack, occurs due to decreased blood flow in the heart. The symptom of shortness of breath seen in cardiovascular occlusion can make the person feel like they are suffocating. This also gives an idea about the severity of the blockage in the heart vessels. Call for emergency help if you feel like you can't breathe at all. Another effect of occlusion in the heart vessels is on the heart rhythm. With cardiovascular occlusion, which manifests itself with abnormal increases in heart rate, you will have a noticeably abnormal heart rhythm. As in a heart attack, in cases of cardiovascular occlusion, pain may be felt, especially radiating to the upper left arm. This pain can also radiate to the shoulders, back and neck. One of the symptoms of cardiovascular occlusion is a heart attack. A heart attack occurs due to complete blockage of the relevant vessels. The resulting blockage causes the heart muscles to not receive adequate nutrition. Overstrain when the heart cannot pump enough blood to meet the body's needs. A feeling of fatigue and exhaustion occurs in the body. This condition is due to blockage in the heart vessels. Another symptom of cardiovascular occlusion that may occur, although it is not common, is abdominal pain. Cardiovascular occlusion can also trigger nausea and vomiting. If there is no other disease or health condition, and if this nausea and vomiting is combined with chest pain and shortness of breath, cardiovascular occlusion may be suspected. How is cardiovascular occlusion diagnosed? For patients who apply to the hospital with symptoms of cardiovascular occlusion, a physical examination is first performed by the doctor. The doctor first examines the symptoms and current condition. He or she may then order some tests to determine vascular occlusion. Tests that may be ordered to diagnose cardiovascular occlusion include ECG, echocardiography, exercise stress test, cardiac scan, cardiac catheterization, and angiogram. How is cardiovascular occlusion treated? The aim of treating cardiovascular occlusion is to reopen the blocked vessels and restore blood flow to the heart. For this purpose, first of all, medications that prevent plaque formation in the arteries may be recommended. The doctor decides on these medications depending on the patient's condition. In cases where the obstruction is severe, coronary angioplasty and stenting may be performed. If many vessels are blocked, coronary artery bypass graft surgery may also be preferred. In cases of cardiovascular occlusions that do not require medical treatment, changes in a person's life may be beneficial. How to prevent cardiovascular occlusion? If you do not want to face cardiovascular occlusion, you should quit smoking, eat healthy, exercise, not neglect heart checks, and stay away from stress.